Hello and welcome to Positive Parenting. I'm DeeAnn Konrad, Community Relations Supervisor for the Sioux Falls School District. Positive Parenting is a joint venture between the education professionals of the Sioux Falls School District and the medical and child development professionals of Sanford Health, and we thank you for joining us here today. We are in or entering the cold and flu season. I don't know if it ever really isn't cold and flu season anymore. But we're going to talk a little bit about some of the changes this year regarding flu mist and flu shots and just cold, all of those things that can help us prevent those issues from the beginning. And then if we do in fact come down with something like that, how do we care for our children as well? So before we get started here today, I will have our guests introduce themselves, and we'll start with you.
Yes, I am Dr. Tracy Jones. I'm one of the general pediatricians at Sanford Children's.
Thanks for joining us.
Yeah. I'm Molly Saturn. I'm the health services supervisor for the Sioux Falls School District.
All right, ladies. So this is a topic that moms, dads deal with every year. It's that cold and flu. It's annoying for one thing, where the kids have the sniffles, they're not feeling well, those types of things, and yet we know it happens every year. Something's going to come around and catch our child, or they're going to catch something. So what do we need to be prepared for this season? Because I know strains of the flu change from year to year. What's the early information telling us about the cold and flu season this year?
You know, so far I think it's still a little bit early to know exactly what is going to come of the season this year. There have been some reported cases already of influenza, mainly in some of the southern states, but at this point there's not a huge surge in the flu here yet in South Dakota. But you know,
what are the typical months?
Usually October to March. However, every season, like you said, is different, and so the last 2 years we've had some later flu seasons where we've really seen the peak of the flu more towards February, March, and even into April.
Mm-hmm.
But as you said, every year is different, and so it's always hard to predict that. Sometimes we'll also see like a bimodal distribution where we have an early season and then a late season.
Okay, so just when we think we know what's going to happen, or
Yes.
anticipate what's going to happen, something
you just
different
don't
comes
know.
up.
Yes. So early prevention is key for that.
Absolutely, and prevention obviously starts at home, and reinforcement is at home. But our schools we're collecting hundreds of kids at a time, and darn it, those germs just like to travel, don't they?
They do, especially in a classroom where you have a lot of kids in a close space. So our school nurses are working to help educate staff and students on how to take care of themselves, washing their hands, coughing into their arm, making sure parents are aware if students are sick and have a fever that they should stay home. Just kind of those basics that we just have to remind people every year about, but they're ever so important.
Yeah, absolutely.
Mm-hmm.
So those basic things, though, when we see them practiced and practiced often, it really is a prevention tool. I mean, it works. It's simple. It's not a medication that you have to take. I mean, it's just do what you're supposed to do.
Right. And there's some basic things that can be done at home too, like as just eating healthy, getting enough sleep, not getting run down. So some of those basic things are always great reminders too for things that families can do at home to prevent illness.
Right. And before we got started, Molly and I were just talking about crazy schedules and kids being, committed here and there and running, and that gets difficult, and sometimes, as Molly said, can lead to just a lower immune system maybe, or that type of thing. Is that a piece we see more often these days?
I think, yes, as children become more and more active with after school activities, that sure can play a factor into it. If you're not getting home, until late into the evening, and then even trying to do homework or your chores or whatever the case may be, they're going to bed later, but still having to wake up just as early, and so you're getting less sleep. You're potentially, as Molly had mentioned, getting more run down, which sure can factor into your body just being able to fight off some of those just common cold or flu symptoms.
Right. So there's always the confusion, it seems like, and a good reminder every year that when we're talking about the flu, we're talking about influenza,
Yes.
which is comparative to the cold, or at least the symptoms are comparative to the cold. We're not talking about the stomach flu. So that influenza and cold, how do we know if it's a cold or if it's influenza? What's the difference?
Usually a common cold, you're going to be able, you may have fevers, you're going to have the stuffy runny nose, you're going to have the cough, but you usually don't get as sick as you may with influenza. A lot of times it's higher fevers, even some chills, muscle aches may come with that. Again, a lot of the runny nose, congestion, cough as well. But usually a common cold comes and goes, and you may not feel great for a couple days, but then it passes, whereas influenza usually will hit you a little bit harder. You'll feel worse potentially with that.
Well, I might have a middle-aged man in my house that it doesn't matter if it's a cold or flu.
Yep.
It's all bad. It's all bad. So I hope he's not watching this anyway. I'm just saying. So what is the going on now with flu shots versus flu mist? I know we were fans of the mist because, you know, what mom really likes to see their kid receive a shot. You know, we've all been through that with when they were little, trying to, you know, get them through those required shots and such. But what's going on with that right now? Because there are some changes.
Yes, so last year they had taken the flu mist off of the market. They had realized with some of their data and research that the efficacy of the flu mist just wasn't nearly as good as the flu vaccine or the shot. And so they had taken it off the market and just the shot was offered last year. And that's going to be the same for this year as well. As far as moving forward in years to come, is the mist going to be offered again? That I'm not sure if we know yet. But ideally, you know, getting the mist is definitely usually a little bit easier as far as convincing families to do that, just because you're not having to do the shot. However, doing the mist without having any benefit really negates the purpose of it. And so we're all recommending just the flu shot this year again.
Okay. Are we participating in any flu shot opportunities for students? Because we've done that in the past.
Yes.
Is that changing or?
Yes. So last year we were not able to obtain the vaccine. This year we are able to in a partnership that we have with the state Department of Health and the City Department of Health. And so we will be able to provide vaccine for middle and high school students in each one of the schools. So we have those dates coming up here in October. Where we'll go out and students can be seen and receive the vaccine right there at school.
So that's a convenience factor, which may convince some families because, as noted, we're all very busy and trying to get an appointment time. If your kids are involved in activities and things like that, can be a challenge. So that convenience is, will it be at every middle and high school building?
Yes, correct.
Okay.
Yes.
And what's the process then? What does, I imagine there has to be a sign off or something from mom and dad or what have you, parents
There's
and
a
guardians?
consent form, and many of the schools have sent those out with their newsletters and have sent out communications to families, but they are located on the district website as well. So the student just needs to have that consent form that day of, and we'll go ahead and get the vaccine then. So.
Okay. And obviously, for probably obvious reasons, we don't do that in the elementary.
Correct. We don't. It really is not. Elementary age students are not conducive to that large setting of sending lots of kids through. We have found that they're better served with their healthcare provider. And sometimes with the younger students, there's actually a little different schedule. If they've never had the vaccine, they might have to get 2 shots, and doctor can speak to that maybe a little bit, but we don't have the capability to know what their previous vaccine history is sometimes to be able to do that in a shot setting, a flu clinic setting. And so we advise that they see their provider for that.
Absolutely. Well, let's follow up with that. So in the case, some students or some children will need 1 shot and some will need 2. Tell us about that.
So the first time that children are eligible for the flu vaccine is at 6 months of age, and we often recommend 2 flu vaccines in that first flu season. However, up until age 8, if they have not received 2 flu vaccines within the same season, then we still recommend doing 2. After that age, then it's okay to go ahead and just vaccinate with the 1 vaccine. But yes, that would speak to the point of the elementary schools. There may be some variance in that, and without knowing the medical history or records of each student, that may pose a challenge.
Right. So in terms of what Sanford is doing this year, will you be doing flu clinics as well, or what are the plans for that?
Yes, the plans for that. We're offering the flu vaccine even now. So when families are coming into the office for other appointments, we are still offering the vaccine, and that goes for all family members that are present that day, not just the patient being seen. And then there will be flu clinics similar to what they'll be doing in the schools during the month of October. And that varies on which clinic you usually visit with, but it does not require an appointment. You just come to the clinic during those office hours, and they're usually offered later in the afternoon after school, so families can come without an appointment and just show up, and we'll be able to vaccinate.
Yeah, that helps with the convenience
Yes.
factor, because if you're on the way somewhere and you think, okay, we have an extra 30 minutes, we're going to stop in and see if we can get that flu shot. And then hopefully maybe we get more people vaccinated.
Exactly. That's always their hope. And again, we would never turn anybody away that showed up for a vaccine at our clinic. So, we always recommend getting it done by the end of October, which is why we usually ramp up our flu clinics during that month to get as many people vaccinated.
Now, if somebody comes in and they're not feeling particularly well on that day, how do we need to be feeling in perfect health?
Not necessarily. We have some criteria that we usually follow, and that goes for all vaccines, including the flu vaccine. But generally, as long as they're not having fevers up above 102, 103, and they otherwise look well, then we usually go ahead and vaccinate.
Okay. So obviously, the more people we have vaccinated, the likelihood of spreading the illness is reduced and that type of thing. So pretty much encouraged for anyone, like you said, at 6 months
and older. Yep, absolutely.
Yeah. And if your kids are going to gymnastics or going to soccer or wherever they're going to be picking up germs along the way.
Exactly. I often will tell families too, just going to the grocery store can put children and adults at risk, and so you can't live in a bubble. And kids are in school, and then they have other extracurricular activities where they're getting exposed to new germs and new people. And so again, prevention is key in making sure that they keep themselves healthy. The best way to do that is to vaccinate.
Right. I know one of the things we really focus on all the time, but in the last couple of years as well, is school attendance. And illnesses can prevent children from coming to school, and certainly we do not want children who are ill to come to school. So we understand that balance between good attendance and staying home when you're sick. What kind of messaging would you share about that?
Well, I would just encourage parents to, if they ever have questions about whether or not they should send their child to school, to reach out to your school nurse. The nurse can really, ask certain questions to identify if it's appropriate for the student to come or not. And they can even bring the student in where we can check a temperature, take a look at the child. Usually if they're fever-free, and they don't have any other major symptoms going on, they're able to attend school as long as, they're feeling up to it. And we certainly just always encourage them to attend as much as they can. With a mild, if you're talking like a mild cold or something like that, and again, reminding them, cough into your arm, wash your hands, all of those basics. But then certainly if they're sick, if they have a fever greater than 100, and if they have other major symptoms going on, we want them to be home. Right. And so it is a fine balance, but we certainly can, encourage that communication between the parents and the school nurse to kind of figure that piece out.
Right, and certainly, while we want them there to be learning and collaborating with their classmates. If they're not feeling well, then that's really not a great place for them to be. You know, there's the couch is probably a better place if that's the case. But again, we understand. We're our school nurses, our teachers, our administrators have all been parents, been around children, and so we understand that it's a delicate balancing act. But certainly, if your child can attend, they should. If there's something that as Molly said, a fever or what have you, then they're best to stay at home. There are, in the case of the common cold and such, there are over-the-counter medicines that can work for that. Mm-hmm. But what happens once the child does have influenza, or what are the recommendations for?
If you're concerned at all, we always recommend bringing the patient in to be evaluated, and whether that would be with the school nurse or the provider. And oftentimes, if we see them early enough, we have the discussion regarding antiviral medications such as Tamiflu. There are certain high-risk populations that we absolutely recommend doing that. A lot of times, though, it's supportive measures taken at home, especially if we kind of miss the window of opportunity to intervene. Usually the illness lasts for 3 to 5 days, and then kids start to feel better. But again, a lot of times, like I was mentioning, it's supportive measures, so just making sure that they're drinking plenty of fluids, and that we offer some other things just to help clear the nasal passages and help with the cough if needed.
Right, and that's, again, I mentioned it's such an annoying, it's just an inconvenience, it's annoying. You can't sleep, you don't feel like eating, you can't taste the food you're putting in your mouth, but it is kind of just cyclical. We're gonna get it at some point in time. So in terms of maybe that kindergarten, you said the nurses go in and teach kids about hand washing and things like, what does that look like? How often or when do we get into the classrooms to help?
The nurses will go in anytime that a teacher requests them to come into the classroom and do some teaching. We have a couple fun kits where in actually a germ costume that the nurse might show up in for the younger students.
You don't do that for high school students? No. Okay.
And we also have some kits where they can put a special lotion on their hand and a light to show, when you wash your hands, and it's a black light, and will show, kind of the residue, and gives them an idea of how important that hand washing is. And so the nurses will go in and do some fun things, read some stories, just kind of that basic education, but making it fun for students. So yeah.
I guess maybe we should be grateful the germ isn't going to the high school students. Who knows how that would turn out? I don't even want to guess, I guess. But what about at the high school level? Are the nurses involved in the health classes?
They are. They can go into the health classes as well. Obviously, their education piece looks a little bit different. And then we're also sending messages home in the newsletters. And posting things in the school and the nurse's office, just basic education on hand washing and kind of just the basics that we've talked about here. So
then I know some of those posters we have in the restrooms at the central office, and those are good reminders, I think, that when you're standing in front of the sink, it's not just one pump of soap and then rinse off. But you do have to take that time in order to keep things healthy. What about like at home when you have a child that has that illness? How much cleaning, cleansing, does that really help us out? Or
I think it absolutely would be able to help. The tricky part, especially with younger children, parents are usually pretty close with them during the time of the illness, and so trying to, again, sanitize or clean surfaces that they may be sneezing on or coughing on, making sure that the provider's even washing their hands each time that they're around the child that is sick, trying to even contain the kid to a certain room, sure can help the prevention if you have other children in the home with you, so not letting that child probably lounge in the kitchen and living room area where it's a common room, but trying to place them in in a location where there won't be a lot of additional contacts to help prevent that spread.
Absolutely, and it does seem like if you're not careful, it can work its way through the family. I imagine you see one child and then you'll probably see down the line.
Other children, yes, absolutely. And so it's same scenario as far as just being in close contact, such as children at school. Same goes for families at home. You just are all living under one roof. And so contact with sick children is sure hard to minimize, but again, trying to keep things clean and doing lots of good hand washing, teaching good coughing techniques, and then trying to prevent the spread as best as possible sure can help with that.
Sure. Is fever always present when it's influenza? Is that a deciding factor between cold and flu, or is it possible in each situation?
I think it's possible in each situation, so I think that that's a little bit trickier. You are going to see higher fevers potentially with influenza. A lot of times, again, with all vaccines, the vaccine is to prevent the illness, but it can also lessen the severity of the illness if they were to contract the disease. So even kids that have had the flu shot, it is still possible for them to potentially get the flu. The concept, though, is that they just don't get as sick as they would if they would have not gotten the vaccine. So potentially they could get the flu, but maybe without the fever or some of the other severe symptoms.
Sure. You always hear every year, I think, people saying, well, I got the flu shot and then I got the
sick.
flu, How do we gauge that between encouraging people to go and get it? It's possible whether you get the flu shot or not, to get it. But how do you then convince people that it is better in terms of reducing the severity?
And that's essentially the conversation that we're having, is that the likelihood of them potentially getting the flu from the flu shot is really minimal, and it's probably just coincidence whether that was another
Did you hear that?
illness.
Say that again.
Coincidence that they got sick just at the timing of the flu shot. So there is not any literature out there that states that they're going to get the flu because they got the flu shot. So just trying to provide adequate or appropriate information to the families, and then just reiterating the importance, as far as what could happen if they weren't to get vaccinated.
Yeah, I know that's one of the things I've encouraged our staff to get flu shots as well, and you guys make it easy because you've had it available for staff members of the Sioux Falls School District, and so it's as quick and easy as stopping by and getting that flu shot in 30 seconds and you're on your way. But convincing people to get it, right? And sometimes I'm nagging at them quite a while. I feel like mom. I feel like I'm mom to them as well. But you do that for staff also.
We do. We offer 3 flu shot clinics for staff a year in October, which will be coming up here. And we're sometimes convincing them, even in the chair, that it will be okay. And, we even talked through some of the side effects, that truly you might have a sore arm, you might be a little bit achy, but, you really shouldn't see full-blown flu.
Right.
That would just be, a coincidence. And so, we certainly see staff, and the whole hope is kind of that herd immunity, and we know they're working in these classrooms with students, and so we want to keep our staff healthy so we can keep students healthy.
Right. So why is it that our arm hurts when we get the flu shot as opposed to other shots?
And that's something that we talk about with most of our vaccines, is some local irritation at the injection site. And there are some vaccines that probably have more potential to cause some soreness to the muscle than others. But you're sticking a needle into the arm, and so
but it's short-lived.
It's short-lived.
It's short-lived. Maybe you wake up and it's a little stiff or sore, and then, within hours it seems like it gets better over time.
Keeping your arm moving and trying to be relaxed at the time of the injection sure can help with that.
Well, that's hard to convince
Yes.
anxious people of. I understand that, and probably kids
too.
Yeah, for sure. So. Well, we're coming up on the end of our time here. Any final thoughts about colds, flus, what we want parents to know about that?
I would just say, continue to take care of yourself and your family and your children, keeping them hydrated, keeping them, eating a good, healthy diet, sleeping well, reaching out to your provider with any questions or your school nurse. And I think our whole goal, all of our goal is to keep everyone healthy. And so just working on those things can make a difference.
Yeah, definitely have to work together. It's a team effort for sure.
Yes.
Yeah.
Exactly, like the team effort. A lot of times parents will get their kids vaccinated, but they may not get themselves vaccinated. And so same goes, they miss work or opportunities to be able to help out at home if they get sick. And so trying to get the whole family on board, keeping everybody healthy is important.
Right. Well, if you have some convincing to do, now would be the time to do that. But do reach out to your healthcare provider and find out when their clinics are available to give that shot, and certainly helps with that school attendance that we know is so critical for kids to be able to stay on track. But again, if your child is ill and needs to be at home, then we certainly want what's best for the child as well. So thank you both for joining us here today, and thank you for joining us on Positive Parenting.